be a hero. You could be a lifesaver. Did you know you could do so by becoming a bone marrow donor? Bone marrow donors are used in many different situations to help save lives. I know how important it is. I used to work with patients who needed such a type of a donation, and I saw the difference that it made in their lives when they got them. According to the American Cancer Society, bone marrow is used to treat various cancers and other sort of diseases. Among the cancers that it treats is leukemias, non-Hodgkin lymphomas, multiple myelomas, and aplastic anemia, as you can see on my slide here. Now that we know some of the uses for bone marrow donation, we're going to talk a little more about some of the questions that come up. Bone marrow comes from the spongy part of the marrow of your bone. When it is taken for donation, it is done in two ways. According to the bone marrow donation program, there is a non-surgical way, which is when it's similar to how they draw blood for a blood transfusion. They take the blood out of your system, and they call it peripheral blood stem cell distribution or donation. The surgical way is the way that most people think of. It is when they put the needle through your hip into the marrow of your bone and extract it that way. It is a little uncomfortable. It is done under general or local anesthesia so that there is minimal discomfort. It is the same-day surgical procedure. You go in the morning, you are done, you go home that afternoon. There are no overnight stays for a donor. As you can see, the donation process is a little complicated, but there's nothing that is that unheard of. It is natural for donors to ask questions. We're going to talk about some of the questions that they ask. One of the first things that they ask is, what does a donor have to do to get onto the donor screening? If you are selected, one of the first things that they do is a standard medical workup. You go to the doctors, you get blood work, you get x-rays, etc. Your blood is taken, it is typed and cross-matched and screened against the recipient to make sure that there is no problems with the match. They purposely do that to lessen the chance of rejection. They worry about the possibility that the bone marrow won't take, so they do all kinds of screening that they can to make sure that that's as good as it possibly can be. After donation, you may have a headache, you may have a little bit of pain at the site, but within 2 to 7 days, you're back to normal and you shouldn't have any more problems. One of the other questions that a lot of bone marrow donors ask is what kind of problems it could cause. It really shouldn't have many side effects. As we talked about, there is pain, but it's only 5% of the marrow that they take from you is needed to save a life. So that it's not a large amount that they're taking, and it has no effect on your immune system whatsoever. In fact, according to the Harvard bone marrow transplant donor program, it should have no effect whatsoever on the immune system. You should be fine and it should be ready to go. One of the other questions is, if you're interested, how do you go about donating? There are two ways. You can go online to the Bone Marrow Registry Program at www.bonemarrow.org and sign up there, or you can call the local American Cancer Society and they will be able to set you up and have you screened for a local screening program within our area. Either way, it's important to think of doing it. You can become a hero, you can save a life, you can help people in ways that you would not even think are possible, because people need this more than you realize. I mean, there are so many people out there whose lives are dependent on marrow, whose lives are dependent on being able to be saved by people that are helping them. And sometimes that's all it takes, is just letting somebody help, be willing to help. The screening process to get to be a donor is very simplistic. It's a simple mouth swab, 2 minutes, open your mouth, swab your cheek, and you're done. And that's all that it really takes. It does not hurt, it's not painful, and it's an important part of life. So please think about becoming a donor. Thank you.
I have a question. What
Sure.
are any of the side effects, like drowsiness, headaches, like
Mhm.
is like any like does it get any more serious than that?
No, there have been no documented cases of serious side effects from donation. It's simply a process by which it is uncomfortable. I will not lie. The needle is big.
Mm-hmm.
It goes into your hip, but it is done under anesthesia. The majority of the reported side effects are pain at the site and a slight headache from the anesthesia. Wears off. I've never seen a documented case in the literature of severe problems post. Post. It's actually a post surgery procedure. I've never seen a documented problem that's serious.
Have you ever donated yourself?
I have not, but I've been on the registry for the last 22 years. Thank you.